Hey everybody, Tom Leyden back with you on the Westwood Living Podcast Network. I'm joined once again by Dr. Ryan Welter from Regeneris MedSpa and Cosmetic Surgery, and we're going to hop right into the whole concept of regenerative medicine and so much of what you do that is well beyond my knowledge level. And I want to just learn a bit about what makes it so unique, what you do here. So a couple questions, like regenerative medicine. Why is regenerative medicine taking over the anti-aging industry?
Okay, well, again, thanks, Tom, for having me again, and I'm so excited to be able to have the opportunity to talk about this in any format because it is so important. The real concept that you really need to understand in today's world is that aging is becoming optional, right? We don't have to just grow old and die like we used to, or are we doing now. I think that David Sinclair is right when he says that the lifespan of a human being is somewhere around 120 years of age without, other interventions or therapies. If we can, keep the toxins, or if we just run the course and do the simple things, if we look at what's going on in blue zones, I don't know if you know what a blue zone is. So blue zones, there's several different parts of the world where people generally live for whatever reason greater than 100 years of age. So we've studied those, and we call them blue zones. Okay. So basically, these people are living to these ripe age as centenarians without much intervention, right? They're just doing normal, healthy things. It's just their lifestyle, their ecosystem that gets them into that longevity spirit. Now, we start to add regenerative medicine to that mix. We start to actually do things to live longer, healthier, and to avoid dementia and all the things that are going to be pitfalls that are going to really lead us to a not so happy end of our life. If we can start to really improve on those things today and fix those things now, make those interventions in our 40s, 30s, 40s, and 50s, and really start to key in on those. And we have all this great technology to do it. If we do that today, we're going to have the potential to really live well, like water skiing well in our 90s. And that's really what we're trying to achieve. And I think we're doing a good job of it with a lot of the people we're treating.
I like that, the water skiing well into our 90s. So How much of that is focused on stem cells and the use of stem cell technology, which really has become much more front and center over the course of the last 20 to 25 years, I would guess. That's how it's hopped on my radar. So how much are stem cells a part of what you do?
It's one tool in a huge toolbox.
Got it.
Okay. Stem cell therapy, first of all, understanding exactly what that is a whole podcast in itself. Just to be honest, it's a big topic. But, people think of stem cells like fetal stem cells from long ago. We don't even worry about that now. In your fat, and this is the most amazing thing, we can take, 10, 20 cc's of fat through a tiny little like needle, syringe type thing. And there are about 2 million stem cells per cc of fat. And we didn't know that until about 2005. And so now we know that the fat is this huge endocrine organ with all of these parasites and mesenchymal stem cells and all sorts of what we call a cellular milieu that basically has a paracrine, which means it can affect all aspects of your body in health and wellness if utilized in the right way. To give an example, one single example, or maybe two, of how we used stem cells here, we've regenerated knees. So I've taken people who literally were going to go to the OR, have an operation to have a knee replacement tomorrow, and basically have come in here, had their therapy, and have not had to have surgery even yet today. Steve Cardillo of Cardillo's World, who's on NBC Sports. I don't know if you know who he is. He's a really great in the body. He just had that done, and he's been doing phenomenally well as himself. Several other patients as well. That's just one thing that we do that is life-changing for a lot of people.
So you talk about Botox and fillers and injections and facials. What's a stem cell facial?
So it's just taking from our toolbox and using the things that we have to basically improve on a cellular level. So it's one thing, everybody has a device or laser or something that might, give you some anti-aging or some time in terms of reducing wrinkles or increasing collagen and elastin. There are lots of ways to do that. But when we start to use cell-based therapies, we really now are starting to activate the cells in your skin, get them to reprogram, to rethink, so that we can have healthier, younger skin for a longer period of time. So a stem cell facial, there's a couple different ways that we do it. It depends on what the patient needs or what the application is going to be. A very simple procedure. It's only takes a little bit of time. It has no downtime, and it's very inexpensive. It's basically to use some numbing medicine and microneedling technique so that we can get into the skin through the epidermis is a layer of skin that protects you. So we want to get through that. And then we get cellular material that we have on site that we can use. It's very safe. It's just with mesenchymal stem cell serum that has all these great growth factors that we can then apply topically that are absorbed and give you a vibrant skin over the course of just a few treatments.
In all of that, you referenced the fact that everybody's an individual and everybody gets an individual plan. So
Right.
when someone comes in here, there's no ABC to a finish line. You got to figure out what works for each individual, right?
Yeah, I think that what happens if you look at, so we run sometimes more like a spa, and people have, I want to do this, I want to get some Botox, I want to do that, and that's fine, that's perfect. We cater to that need and do that sort of thing. But a lot of people come here specifically because they say, well, I don't want to just look better. I want my skin to be better. Right? That's a completely different set of circumstances. It's a completely different approach to, how your skin looks. If it's one thing to make it skin deep, so to speak, and it's another thing to really turn back a clock and rewind and make the cellular activity all much more enhanced. It has to do with, IV therapy, for example. I mean, a brilliant way to help basically increasing cellular metabolism, red light therapy, cell-based therapies, all of these things that can get your skin, your inner workings, and all your cells to work at a level that is, I like to say, about 10 years, younger than where you are today.
Okay, so based on my observations, I would guess that there are probably a good handful of people who walk in here wanting the simple stuff. Just like, I want a facial. I want to feel better. Do you almost view that person as a great prospect to understand more about how this practice works? And you say, okay, we're going to start that way, but I'm going to give you an education along the way and maybe change your way of thinking.
Yeah, I think that to your point there, if you're someone who's thinking like, I've been thinking about maybe doing some Botox or doing some filler or maybe just having a simple facial, come here. Get that simple procedure done, and then we do take that time to educate every person that walks in the door, because we want to make sure that every person that walks in the door has at least some idea of all the things that are possible, whether or not they're ready to do that today, or whether or not some of them don't need it. Some of them, come here pretty young and they're doing just fine right now. But a lot of times it takes that motivation education to learn, and that's a big part of what we do. Exactly.
Well, great stuff. I loved learning a little bit more about that. And folks, there's a reason why Dr. Welter is the expert contributor in this category, which is Med Spa and Cosmetic Surgery. You can read his articles at least once a quarter in Westwood Living. That's the greatest part about what we do. We put these professionals who know a lot more about these topics than we do in a position to share their expertise with us so that ultimately you can benefit from what their services provide. So once again, thanks. The next episode, Dr. Welter is going to talk specifically about hair restoration, because I think I'm now on episode 86 or 87 or 88, and we have not talked about hair restoration, and that is a big topic, most notably for people who are in our age group. So, and men and women, right? So that's next. So that's Dr. Ryan Welter from Regeneris MedSpa and Cosmetic Surgery. Thanks for listening to this episode, and be sure to tune into the next episode with Dr. Welter, where we do talk about hair restoration.